Hi guys, today I want to talk about an unpleasant and often distressing topic, but one that's actually the fourth most Googled health complaint: diarrhea. Diarrhea is basically when you pass looser or more frequent stools than is normal for you. The good news is, if you suffer from it, you're not alone. It's extremely common and normally it's nothing to worry about. A bowel infection is the most common cause due to a virus like novavirus or rotavirus, or bacteria like E. coli, which you can pick up from contaminated food, or a parasite which can spread through contaminated water. Diarrhea can also be caused by anxiety or food allergies, or often medication or long-term conditions such as irritable bowel syndrome. The good news is most cases will clear up themselves, and after a few days, particularly if caused by an infection, and seeing your doctor isn't always necessary, but remember, it can lead to dehydration. Quite severe in some cases, so you should drink plenty of water, take frequent small sips if possible to get your hydration back up. This is usually important if you've been vomiting as well. If water alone is too much, try to drink fluids that contain water, salt and sugar, like water mixed with fruit juice or soup broth. I'd advise against making fruit juices too strong and avoid fizzy drinks altogether, as the carbonation and acidity can have a negative effect on your tummy. As for what you should eat and when you should eat it if you have diarrhea, that's a tough one to answer. However, the general consensus is you should eat solid food as soon as you're able to. Go with small, light meals and avoid heavy, fatty or spicy food. Rice, potatoes, bananas, soup and boiled veg are great options, and salty foods can be really helpful. If you've lost your appetite, don't worry, it'll come back, but until it does, continue to drink plenty of the right fluids until you feel up to it. So I hear you ask, which medications can help? Though they're not usually necessary, antidiarrheal medications may help reduce it, and the main one your pharmacist will no doubt recommend will contain loperamide, which comes in tablet form. They slow down muscle movements in your gut, so more water is absorbed from your stools, making them firmer and less frequent and urgent. Rekestrol is similarly effective, and it comes in the same way as loperamide does. Remember, check information leaflets that comes with the medication to see if it's okay for you to take it, and please talk to your pharmacist first. It's not a good idea to take antidiarrheal medication if there's blood or mucus in your stools, or if you have a fever. If so, please contact your GP before you do anything else. Oh, and best not to give any of these to kids, adults only. So, painkillers, no. They won't help unless you have a fever or a headache accompanying your diarrhea. But again, paracetamol is much less likely to aggravate your already upset stomach, especially if you haven't eaten. Antibiotic therapy isn't recommended generally if the cause of your diarrhea is unknown. Antibiotics won't work if your diarrhea is caused by a virus. They can create some really unpleasant side effects on top of your upset stomach, and if overused to treat relatively mild conditions, can become less effective at treating any more serious conditions in the future. Your GP will be able to advise on what will and won't be possible for you. Very rarely does diarrhea become severe enough to warrant hospital treatment. If you're elderly or frail, your GP can advise taking an oral rehydration solution, which you can dissolve in water and drink quickly to replace the lost salt, glucose and minerals that result from bouts of the runs. If you've been diagnosed with a specific health condition that causes diarrhea, then your GP will know how to treat this to improve your symptoms. For the rest of us, it's something that we all unfortunately have to deal with from time to time. And while it's never great, I hope this video puts you in the know about what to do if and when it happens.